Great, thank you.
Should be recording.
Thank you. Morning, everybody. I'm officially calling to order the March Long-Term Care Planning Committee meeting. Today is an extremely busy day. I feel like our March meeting always somehow falls on a human service public hearing. It's just the way it goes. So we have a lot to cover, and I want us to be able to get through and perhaps end early because I know our lead presenters have to get over to the public hearing at 11. So two just quick announcements up top that I'm not going to elaborate on at this meeting, and we'll try to follow up in the interest of time via email. And now that I see Michael has joined, why don't we start with roll call, and then we'll get right into the meat of the meeting. Andre, would you mind calling the roll?
Absolutely. Melissa Martin.
Here.
Christine Weston.
Here.
William Steele. Margie Grundo.
Here.
Kelly Kendall.
Kelly is not here today, but Krista is her representative for DDS. Thank you.
Okay. And then you were next, so present. Erin Leavitt-Smith. Barbara Cass.
Present.
Amy Porter.
Present.
Jessica Reval.
Present.
Lisa Rivers. Michael Santoro.
Here.
And Laura Watson.
Here.
Great. Thanks so much, Andre. Appreciate it. So today, the bulk of our meeting is going to be a presentation from the Department of Aging and Disability Services. What I would like to start doing is this group focuses so much on Medicaid, which is extremely important, but the state has so many non-Medicaid services and supports that I think tend to get lost in the shuffle. So what I want to try to do with this group is start looking more holistically, not just focusing on the annual updates we get from Medicaid and the rebalancing team, which is so important, but also hearing from our other state partners on some of the Medicaid and non-Medicaid options that are available across the state. And Commissioner Porter and Margie have graciously offered, in coordination with their team, to put together a presentation on the services and supports that their department offers. As many of you have probably seen, if you've been following session, there's a lot going on that would affect human services agencies this session. There's some big ones that would affect aging and disability services specifically. So good time to just catch up and remember what our sister agency does. Before I turn it over to them, I did want to just mention two things that I want the committee to be aware of. The first, we do have a piece of legislation out there right now that directly affects the Long-Term Care Planning Committee, SB 1416, and I will put the link in the chat, actually would require the Long-Term Care Planning Committee to complete another report to look at how to ways to expand home and community-based services under Medicaid and have Medicaid serve more people in the community. The bill also would require that the report not only look at how to expand Medicaid services, waiver services to serve more people in the community, but that we also do it by demonstrating the cost savings to the state in doing a shift by serving people in the community versus a nursing home. If those data points sound familiar and like something we report on in our long-term care plan, you would be correct. So we don't do it exactly the way they're asking for it to be presented in this piece of legislation, but it is data that the Long-Term Care Planning Committee does put together. So, just tracking 1416, because it could mean that we have to work as a group to reconfigure some of the data that I collect from all of you when doing the rebalancing updates annually and the 3-year plan to in very short order, because as it stands now, we only have 3 months from time of passage to put together the report. So stay tuned as we see what happens with that. The other thing that I wanted to flag, and in the interest of time, rather than discussing it today, I will send out a follow-up email, and then we will pick this up in June and have it be along with our annual legislative wrap-up update. We will also discuss this, is the fact that this group has decided that we are going to be overhauling the long-term care plan. We are going to be revisiting our goals, the style, the layout, what we want the plan to do. And of course, we have to do it within our statutory charge. But it is a big undertaking to completely revamp a plan of this size. And so what I am going to propose to the group, and we can discuss further in June, but I'd like you to start thinking about now, is I would like to propose we put together a subcommittee that focuses solely on the development of the new format for the next long-term services and supports plan that would be due January 1st of 2028. That subcommittee can be comprised of members of this group or the designees of members of this group. And we can discuss what that would look like and how we want to move it forward. I think that because it's potentially such a big change in direction for us and looking at 2 new goals and seeing what comes out of this legislative session, I don't want to wait to the last second. I would like to get a subcommittee together over the summer, set a meeting schedule, and begin working on it now so that we can solicit meaningful feedback from users of the long-term services and support system, from providers in the system, as well as, all of you, to really think through how we want to move forward with the plan and where we want this group's focus to be. So rather than discussing it now, just please think about that, who you might want to be on the group, what you think this should look like, and we'll have this as a discussion item at our June meeting. So hopefully this will give everyone time to really think about it. Any questions before I jump right into the meat of our meeting, which is our presentation from Aging and Disability Services? Okay, seeing no questions, Commissioner Porter, Margie Durando-Marquette, I turn it over to you.
Great, thanks, Melissa. We thought we would do just a high-level overview today of the agency and then, be able to entertain any questions that any of you have about specifics. We work with so many of you on a day-to-day basis, and our work is really dependent on our partnerships. So let me start out first with a thank you to all of you for the partnership on aging and disability services for us. So Margie, you're going to share the screen. Do you want to jump in before we kick it off?
Good. Can you see the slides?
Yes.
Great.
Perfect. Okay. So aging and disability services you can go to the next slide, Margie. Our programs and our policies, our practices, all of those are designed to be able to deliver aging and disability services that are responsive to the needs of our citizens. We try to provide leadership on aging and disability issues statewide, try to partner with various agencies as they're looking at accessibility issues, as they're looking at universal design, and thinking through aging and disability issues. We provide and coordinate programs and services in 5 major areas: employment, education, independent living, accessibility, and advocacy. We advocate for the rights of Connecticut residents with disabilities and older adults, and we try to serve as a resource on aging and disability issues at the state level. At the bottom there, you'll see a link to our website. You're all familiar with the state websites. We are very excited because ours just got redone in line with the new state platform, and it's organized by those 5 services that I talked about, or 5 categories of services, to make it easier for people to find if they don't know exactly what program they're looking for, if they don't know exactly what bureau of our agency they're looking for, or even what department they're looking for. That along with the rest of state government, where we were able to finally update our website and join many of you who have already done that. So take a look at it if you get a chance, and feel free to give us feedback. Our history, if any of you have been around for a while, you know we like to change our name pretty regularly so no one can find us. We were created back in 2011 as mainly a disability agency. One night we went to bed and thought that we were going to get some new programs, new disability programs under our bureau within Department of Social Services. And the next day we woke up and we were a department. Actually, we had an interim Bureau of Rehabilitative Services name, but we were a standalone agency starting back in 2011. And then in 2017, Aging Services became part of our agency, sort of in line with what happened at the federal level where aging and disability services were together. A lot of folks questioned whether they should be together. We think it's a really good fit when you look at functional need, when you look at really what it is that you're trying to address for a person. It doesn't matter what the disability is. It doesn't matter what the age is. It's really about what is the need and how might we be able to address it. So that's sort of our history. For those of you following the legislative session this year, you might have noticed there's a bill to create a new standalone Department of Aging. We testified against that. We don't think this is the time to do that. We think that having aging and disability services together under one roof makes a lot of sense. Our disability and aging components spend a lot of time working together. There's a lot of cross-functional work that happens. So in case you're in any of those discussions, that isn't something that came from us, and we don't necessarily think it's the time for that. Margie just put up the list of our bureaus. So some of you may be familiar with our bureaus and you may not, but the one you're probably most familiar with is our Bureau of Aging. Because Margie's been a regular member of this group, so you hear from her pretty regularly. We also have a brand new bureau for individuals who are deaf, blind, or hard of hearing. The bureau is just one person right now. We hired an individual as the director of that new bureau. Their name is Morrison, and they started at the very end of the calendar year. So they're just getting started. They're getting introduced to the communities and really trying to understand our needs. So we're thrilled about that because there's a huge gap there. We also have disability determination services within our department. They're the folks who make decisions about whether somebody's eligible for Social Security disability insurance or supplemental security income, SSI or SSDI. So they're 100% federally funded by Social Security, and they make Social Security determinations. Christine Weston and I just had this conversation the other day about sort of their role and how it's different from some of the Medicaid determinations that happen through Colonial Cooperative Care. So we have that group. We also have the Bureau of Education and Services for the Blind, who work with residents who are blind, deafblind, or individuals with low vision. We have the Bureau of Rehabilitation Services, whose major programming is around employment, but also independent living. And then we have the Long-Term Care Ombudsman Program, who I know you're all familiar with. They help individuals. They advocate for the rights and well-being of individuals who live in skilled nursing, residential care homes, or assisted living facilities. And I think, Margie, did you want to jump in next? You just went back on mute. You came off and then went back on.
Thank you. Just trying to get my slides moving. So great. So I thought I would share a little bit about each of our 5 core areas, the employment, education, independent living, accessibility, and advocacy. So to start with employment, ADS offers a wide range of employment services designed to help older adults and individuals with disabilities prepare for, secure, and maintain meaningful employment. ADS helps people find and keep fulfilling jobs. The staff can help with employment needs, whether you're employed, looking for a job, or unable to work. And our website has a lot of great information on this now. For each of these situations. So for job seekers, staff can help with job searches, interviewing skills, resume writing, and to highlight a couple of programs in the Bureau of Aging, we have an employment program for older adults, and it helps people who are low income, 55 and older, to re-enter the job market. And participants are placed in short-term subsidized training jobs. And then we also have, of course, within ADS, the vocational rehabilitation services. And this program helps people with disabilities prepare for getting a job. And it helps them find the right job and to be successful. So there are support services available to older adults and people with disabilities that currently have a job, counseling, retraining, career planning, and also programs for people who feel that they are unable to work because of a disability or they need help returning to employment after an injury, like the Workers' Rehabilitation Program that assists eligible individuals with work-related injuries to return to the workplace. And then also for employers, business partners with our department's rehabilitation services to assist with their needs.
Margie, I think
Margie,
someone
I
got
think you
muted
muted.
again.
Yeah.
Yeah. You got muted.
Yeah.
You got muted when you moved the slide.
Oh, not cooperating with me today. Okay, should I start from the beginning with education services?
Yep.
Thank you. Okay, so this is another core area, and ADS provides educational resources for individuals with disabilities and helps people learn at every stage of life, from infants with visual impairments through childhood education. For example, students who are blind or have low vision. Services include Braille education and family support. High school and college and beyond, their school support, school to work transition support, career training, and for educators and parents, there are training opportunities, guidance, and best practices for students with disabilities. And our next core area, not muted, is independent living services. And ADS wants people to live their most independent life. And there we go. So we look to provide services to help older adults and people with disabilities live independently within their communities. We have supports around healthy living, and I do have a slide on that. We have transportation options that we help folks with, independent living resources. I also have a slide to share on that as well. And deaf-blind community inclusion supports that include recreation, communication, and socialization for adults age 21 or older who are deaf-blind. So getting to healthy living within our core area of independent living, just wanted to highlight a couple things here. We've got some great programs here. Healthy living or healthy aging is not only about living longer, but living well. And we believe everyone should have access to services that help them manage their health and quality of life. So, of course, we have our senior nutrition program that provides nutritionally balanced meals, reduces hunger and food insecurity, provides socialization and informal support networks. And home delivered meals are provided, and meals are also served at congregate sites like senior centers. And through this program, about 2 million meals are served to over 20,000 residents every year. And then we have 2 programs that offer supports to informal caregivers. And that's our state-funded statewide respite care program that focuses on caregivers of people with Alzheimer's and related dementia. And then our National Family Caregiver Support Program, which is federally funded, also provides a lot of support to caregivers, including respite, but other supports as well. And then we have health promotion and disease prevention programs, which are offered in communities across the state to support healthy lifestyles and prevent chronic diseases among older adults. And a highlight here is our fall prevention program, which focuses on decreasing the rates of falls among older adults. And this initiative is supported by the Department of Public Health, healthcare providers, and many other partners. And I think I might have mentioned at one of our previous meetings that we have a new falls prevention coalition called Falls Free CT, and that's a partnership with our department and the Department of Public Health. And we also have Live Well, which is a chronic disease and chronic pain self-management program, which supports older adults who have ongoing health conditions like arthritis and diabetes. And we have independent living resources as well. We partner with so many community-based organizations, agencies across Connecticut that support individuals and families to live independently in their communities. This slide just has some of our key funded partners as the area agencies on aging and the Centers for Independent Living. The 5 area agencies on aging receive Older Americans Act funds through our Bureau. I know I've talked about them before. They provide a range of services through local providers, nutrition, health promotion, caregiver support. And then the Connecticut's 5 Centers for Independent Living provide consumers with support, training, education, and tools they need to live independently. All of them are key entry points to connect people to aging and disability services. And another core area is accessibility. And accessibility is at the heart of the ADS mission. Our services provide information, activities, and environments in a way that's usable for all to fully participate. They include assistive technology, and ADS offers many programs that help with assistive technology. I know we've talked in this group about the Connecticut Tech Act project, which helps individuals have access to assistive technology devices and services. They have a loan program. I've talked about the Bridging the Digital Divide program, which serves a broader community and provides tech support and training to increase access to technology. We also have accessibility at home as well to learn how to make their home safer and more comfortable with accessibility equipment and modifications. And the 5th core area is advocacy. We believe in promoting self-advocacy in the community, and through our programs, we provide residents with counseling and information to get them the support they need, and this includes directing them to important resources. So for benefits counseling, for someone who wants to work but doesn't know what could happen to the benefits they're receiving, this service helps with understanding how employment may impact their disability benefits. Fraud prevention, we have information to help make sure people are not victims of fraud and scams. We have our Senior Medicare Patrol program, which really focuses in on helping people with Medicare spot and report healthcare fraud. And related to this topic, but broader, we have the Coalition for Elder Justice in Connecticut as well, statewide group of stakeholders who are working together to prevent elder abuse and protect the rights and security, including looking at scams. Health insurance counseling, this is our Choices program. I do have a slide on that, which I'll talk a little bit about. legal assistance. We connect people with legal resources. And ADS also offers resources and support for LGBTQ older adults. We have information, resources, and community connections for older adults within this community. And the long-term care ombudsman, we know you know them as well. We do have a slide on that too. So for choices, love the Choices program, been working with it for decades. It is one of our advocacy services. We know that navigating Medicare can be complicated. Choices offers help with this as a trusted local resource. It helps people understand their Medicare coverage and healthcare options. And Certified Choices Counselor provide objective, free, unbiased assistance so people with Medicare can make informed decisions about their benefits. And I know that this whole group knows all the work that they do during open enrollment period, providing enrollment assistance and plan comparisons for people, providing community outreach. And of course, we have our 1-800 number that routes to the Area Agency on Aging so that they can speak to a Certified Choices staff member. And then, of course, there's the long-term care ombudsman program. They work to improve the quality of life and quality of care of Connecticut citizens residing in nursing homes, residential care homes, and assisted living. And they work on behalf of and at the direction of all residents. No, I'm telling you something you already know. Love to keep talking about the Ombudsman program. Within the Ombudsman program is the Long-Term Care Community Ombudsman, who is a dedicated advocate who works to improve the quality of life and quality of care for those receiving long-term services and supports and residing in community settings. And right now under one of the Department of Social Services waiver programs. And many of you know Mairead Painter, the long-term care ombudsman, who does such incredible, important work with her team. And Jan Beam is the long-term care community ombudsman, great addition to their team. And so I do want to acknowledge, just as Commissioner Porter did, the work that we do with so many great staff, state agency partners, all of you, our community partners who are really dedicated to this work. And truly appreciate partnership and collaboration. And certainly when we all work together, we can better serve consumers. And wanted to see if Commissioner Porter has anything to add, and I will hopefully stop sharing.
Thank you, Margie. That was great. And again, it's just a broad overview. We wanted to give folks, most of you know what we do, but we wanted to give folks a reminder, as Melissa asked us to, and see what kinds of questions you had. So we're happy to answer any questions you might have now.
Thanks, Commissioner and Margie. I had a question which I'm embarrassed to even ask. I just literally do not remember. Is there any self-direction under the respite programs? The National Family Caregiver and the
Yes.
there is. Okay.
Yeah, so there's a traditional option and there's a self-directed option. Yes.
Okay.
For both. Yep, both programs.
Great. Thanks. I see Barbara has a question.
Thanks, Melissa. So I'm glad you started your question out that maybe you'd be embarrassed and should know. So maybe I should know the answer to my question. But thank you, Commissioner Porter and Margie. It was really, really helpful. I didn't realize your scope was that big. So it was helpful for me. And I'm curious as to the intersection with DDS and the intellectual disability component of it. Do you work exclusively with individuals who have physical disabilities, or does it also include ID as well?
Yeah, that's a great question. We cross disabilities in our agency, particularly in our employment and independent living programs and assistive technology. So there are times when we work with DDS and we might partner particularly with somebody who might be looking at competitive integrated employment. So we would work with DDS and sort of together figure out the right supports necessary for an individual to be successful. We also work with DDS on benefits counseling around employment. And assistive technology is a key area for both agencies, and we partner a lot in that space as well. Margie, do you want to add anything from the older adult perspective?
Yeah, I think it's just keeping that connection through various programs that we have, including like our caregiver program and things like that. So yeah, I think we just try to cross pollinate and coordinate.
Thank you.
Anybody else have questions? So not seeing any questions at this point. As you go back and look through the slides, if there are any specific programs that you heard about during the presentation where you would really like to learn more, perhaps it's, you want to learn more about what they provide for employment services or assistive technology or nutrition services and benefits counseling, whatever it might be, please feel free to shoot me an email and we can always ask ADS to come back and give a more in-depth presentation on certain programs to do more of a zoom in. That's how we approached it. If you remember years ago, when Department of Social Services started doing their rebalancing updates, they're still quite lengthy updates, but they were updates. And then we said, hey, could you hone it in onto a few specific programs so we could learn more in depth about each of the rebalancing programs. And so happy to do that again here. I hope I'm not speaking out of school, Commissioner and Margie.
Yeah, we're happy to answer questions one by one. If folks want to just reach out individually to Margie or I, or if there's a particular area that you get multiple questions about, yeah, we're always happy. We try to be at these meetings as often as possible because we learn a lot from our partners. So happy to do that. And sort of thinking about Barbara's question, like there's so many intersections for all of our work, it almost might be fun to pick a topic and then think about who are the different agencies that work in that space and what does it look like. So that might be an alternative to just hearing from one department on a particular area. So if there is an area of interest there, that might be another way we could tackle it.
Yeah,
So
that's
thanks.
a great.
I'm hoping Human Services lets me off this easy.
Yeah, I don't think so, but I will hope for you. So I think, Commissioner, you bring up a great point, and part of why we're doing this round robin of agencies is because as we start to get into relooking at what is the next long-term services and supports plan going to look like, I think it's very important that the group have a good understanding, again, not just theoretically what each of our departments do, but picking up on where is their intersection, what are our roles, how can we better coordinate, so that we are starting at a baseline of having a better understanding of what each of our individual departments do and where there's a chance as we write the new long-term care plan to maximize resources, to work together, where are places where there's a natural intersection to coordinate the system, to make not only our agencies and our programs run more effectively and efficiently, but also to make it easier on the people we serve. That, the more we know, the better we are able to make sure that when somebody needs a service or a support, that we can get them the best package of services. And for some people, it might be, okay, we just need a Medicaid waiver. For others, it might be that they just don't know there are other things out there that if you piece them together could get you just the supports you need, including sometimes just avoiding caregiver burnout by supporting our caregivers and letting them know they have resources. So I really appreciate you taking the time today on this extremely busy day to give that overview. And if there are no other questions, I am going to scoot us along. Anybody have anything else? Okay. So with that, thank you so much, Commissioner Margie. And if you could extend our thanks to any staff who might have helped you, I very much appreciate it. That was excellent. I'm going to open it up now to our member updates and announcements. Do any members of the Long-Term Care Planning Committee have any updates or announcements that they wish to share with the group this morning? Margie, yes, you already had your time. No.
I had already talked too much, but it's all related. So I figured this might be a good time to just say, since we're talking about working across state agencies and what the next long-term care plan looks like. So we are applying for a No Wrong Door infrastructure grant from the Administration for Community Living. And it really seeks to pull together the No Wrong Door components in our state into one formalized and unified system for better consumer access to long-term services and support. So we appreciate the support from all the state agencies we've heard from so far. And if we get the grant, we want to add more state agencies to our group. We also have a lot of the community-based agencies as well. We think this is a great opportunity to work across agencies and really make us as cohesive as possible. So just wanted to share that because I thought it was related to what we were just talking about. Thanks, Melissa.
Excellent, Margie. And do you know when we hear if Connecticut, when the grant recipients are going to be announced? I know the grant is due sometime this month, but I wasn't sure if there was a date for announcements.
Yeah, so at the grant due on Monday and the project starts September 1st. They didn't give a date, but it will be sometime over the summer, we anticipate.
Great. Excellent. Thank you for pursuing that grant. I think anything we can do to coordinate consumer access to information is a good thing. So thank you.
Thanks.
Anybody else have an update that they would like to share? Okay. So with that, we'll move on to updates from the Long-Term Care Advisory Council. I think I saw Michael on. Michael, are you here?
Yes, I am. Thank you very much. So appreciate everyone. Speaking of human services, they have another public hearing in a few minutes. We are submitting written testimony for that. Just really want to express appreciation to everyone during this very busy time of the year. We will be having a meeting of the Long-Term Care Advisory Council. I typically like to have it very soon after the Planning Committee meets, but just because of the very crunch time nature of right now, I'm going to follow up with everyone about when that'll be, but we hope to have that soon. And just general praise to everyone here at the Circle for all the hard work you're doing. I also really appreciate particularly the work of the Department of Aging and Disability Services. So thank you all for being here. And that's just my general reflection for right now. So thank you all. And thank you, Melissa, too, for all your leadership in this work. Thank you.
Thanks, Michael. We'll stay tuned for your meeting announcement, and thanks for all the work that that you're doing with the commission and that the advisory council does to support the planning committee. One update I forgot to give just as a reminder is that the long-term care planning committee, we did submit our 3-year plan on December 30th. That'll take us through December 31st of 2027. And we submitted our annual rebalancing plan. All of that is up on the Long-Term Care Planning Committee webpage. And I thank everyone. That plan is about a year-long process to put together, and could not have come together without the help of our friends at the Long-Term Care Advisory Council for their public input on our recommendations and all of the data and program updates that each of the agencies who are part of the Long-Term Care Planning Committee provide. If you didn't provide the data, we wouldn't have a plan. So thank you for helping this group to meet its statutory charge. and for having another successful planning cycle. I look forward to getting back to tracking progress on the long-term care plan and to see where Connecticut goes in creating a more cohesive and accessible long-term services and support system. And is there any other business before we adjourn to all pop over to Human Services? Okay, seeing none, I'll entertain a motion to adjourn, please.
So moved.
Thank you, Michael. Is there a second? Thank you, Barbara. So Michael Santoro made a motion, Barbara Cass seconded. And with that, we are adjourned at 10:43. Thanks, everybody. We'll see you in June.